can we draw or underline on the answer sheet of reading and listening? Yes, I answered a similar question to that earlier. That's absolutely fine for underlining or circling the question words, for example, or answer options. That's absolutely fine. Mariam says, if I mistakenly mark a wrong answer in reading part B or C, how can I undo it properly? So the instructions are, if you make a mistake in reading or listening, parts B and C, as you know, you have to shade in the circle of the answer that you think is correct for those parts of the test. If you make a mistake, simply erase it with your rubber and then shade in the new circle answer that you think is correct. You can do that more than once. Perhaps if you change your mind and you want to go back to your original answer, just erase the answer and make sure that your final answer is clear and completely shaded in. Dabashi says, in writing, can we start from first paragraph from today's visit or chronologically where we place medical and social history? So this is absolutely one of the choices that you have to make depending on the situation. So it could be that you write the letter chronologically. It could be that you write the letter starting with the most recent visit and then returning to the first visit. It could be that you write the letter thematically. So, for example, using paragraphs about social history and paragraphs about medical history and so forth. This is one of the decisions you need to make based on the task that you have and the reader receiving the letter. You need to decide which order, which kind of letter would be most appropriate for that reader, and that's the decision that you make. Tayaba says, in writing after the introduction, we have to describe the current medical history and then the past medical history. So that's a very similar question, I think, that I've just answered. John says, is using semicolon not allowed? No, semicolons absolutely can be used in appropriate situations. So I don't know where you heard that information from, but it's inaccurate. Always good to check with OET to make sure your information that you've read somewhere else perhaps isn't misleading, in this case it is absolutely inaccurate. Another question from Tayaba, who says, is it necessary to write abnormal value of blood reports, or we just write anemic instead of HB value 6? I can't really give you an answer to that question because it would depend on the reader. For someone who is a blood specialist, for example, they're likely to want the detail, whereas someone who is maybe an allied health professional or someone who isn't treating the blood condition specifically, then a more generic value may be more appropriate. So you need to decide depending on the reader's specialism and what would be clearest to them. Maria says, could you please tell if there's any app from the Play Store which we can practice reading and listening? Unfortunately, we don't have an app at the moment. It's something that we would like to develop, but the best places for you to go for preparation is to the OET shop. We don't have any apps available there, but we do have online courses, things like feedback vouchers, as well as longer taught courses available for sale through the shop from our premium providers. Hafiz says, how should we write the dosage? Is it important to put a comma between a drug name and milligrams, such as Lasix 50 milligrams with a comma? It depends. We do have a help article on that on our website. If you go to the OET website and search for medication, you will find a help article on where commas can most usefully go to be clear to the reader. Potentially, if you're giving more details than just the dose, for example, when to take it in the day, or perhaps whether it should be taken with food or water, for example, then a comma may be useful. But if it's just the name of the drug and the medication dosage, potentially you don't need a comma there. Sri Lakshmi says, if a nurse is described as a nurse in charge in a letter, can we write as registered nurse or charge nurse when we finish the letter, which is the right one? To be honest, I'm not a healthcare professional, so I'm not 100% clear on the differences between levels of nurses and job roles. So my advice would just to simply copy it as it's written from the case notes. So if you're described in the case notes as the nurse in charge, then at the end of the letter, I would just write the job title exactly as it is. And that way you won't make any mistakes or be penalized for something if it was incorrect. Mariam says, in speaking, if we are asked to explain something or a procedure that we don't know, can we ask about it in our prep time? So during the preparation time for the 2 role plays, there's about 3 minutes before the role play starts. You can ask the interlocutor questions if there is a word that you don't understand on your task card, or there's a word that you don't know how to pronounce. They cannot tell you information about the condition, but they can define a word. So if there's a word on the task card that you're not familiar with, as an example, let's use the word jaundice. If you're not familiar with that word, you can say to the interlocutor, I'm sorry, I don't know what jaundice means. And they can give you a definition. For example, they might say it's a condition which causes yellowing of the skin. That will then help you to understand that word. But in terms of if you're supposed to explain a procedure and you're not familiar with the procedure, there's a good chance the interlocutor won't be either, because as I mentioned earlier, they're not healthcare professionals. So in that case, the best idea is just to make something up, to use very generic healthcare situations, other situations that you are familiar with, and to use that as your explanation. You're not being tested on your medical knowledge. So provided you give that explanation using good English, it won't cause any impact on your assessment score. Hafiz says, if a doctor is discharging a patient to the community nurse for wound dressings, what should be included in that letter? Should we mention the past medical history and the medications? Potentially. There isn't one correct answer I can give you there. Although you've given me quite a specific situation, I don't know what has caused the wound. I don't know what of that past medical history may be relevant or not. You need to make those choices. There isn't a magic wand I can wave and tell you in all situations you must include this kind of information. You need to look at each writing that you do individually and decide on the best personalized option for the patient that you're dealing with and the person that you're writing to. Amma says, the use of connectors, what are the appropriate words? For example, furthermore or moreover are accepted or not? Is it appropriate to write the patient instead of Mr. Jones, for instance? So Amma, we have a couple of help articles about these things on our website. And the best thing for you to do after this session is go to the website, click on the link that I put at the top of this live session, visit our website and search for connectors and search for patient's name. And we have 2 articles that will help you on that. To briefly answer your question, furthermore and moreover are recommended to be avoided in OET writing because these are academic essay style connectors and are not used frequently in healthcare writing. Instead, connectors like however, during, although, therefore, these are much more appropriate for OET writing. In terms of the patient's name, when you're writing about a patient, it is polite and personalized to use their name rather than the patient. So you may say patient perhaps in the introduction. For example, I am writing to update you about your patient, Mr. Jones's condition. But other than that, really using the patient's name or a pronoun, he or she, is much more polite than using the patient. So that would be our recommendation there. Anandan says, with an extreme appreciation, I request you to provide health education regarding a healthy diet. Is it correct? I wouldn't go for such extreme words as extreme. With an extreme appreciation seems overly formal for this situation. Although this is a formal letter, there are still levels of formality within formal writing. And I would suggest something like, it would be appreciated if you could provide health education, rather than sort of including unnecessary words that are not really communicating anything useful. So I would moderate that slightly, Anatan. Here's a question about verbs. What is the difference between has had and has been? So both of these are present perfect verbs. Has had is the present perfect form using the verb has, and has been is the present perfect form of the verb be. So they're different for that reason. And if present perfect is something that you don't feel very comfortable about, I'd recommend doing some research on the internet. There are many resources available focusing on verb tenses. Have a look at the uses of the present perfect. Question about listening. How about in listening? Can we give answers as many as we can? No, this is coming from the same candidates. The same advice is true here as well. In listening, particularly listening part A, a single answer only will be accepted by the assessors. If you are writing more than one answer, again, you will score 0 automatically for that answer. And a question from the same candidate, in listening, is it okay to cross out wrong answers? Yes, absolutely. In pen or pencil, just draw a line through it and then to rewrite your answer. If it's listening part B or C, as I was mentioning earlier, you shouldn't cross it out. You should actually erase it with a rubber, because listening parts B and C, as well as reading parts B and C, are marked by a computer, and the computer will be confused by something that's been crossed out. So make sure you erase it and only one answer is left on the page. Ria says, when is it advisable to use yours sincerely and yours faithfully? So Ria, we also have a help article on this, ending the letter correctly. But just to briefly advise you, so there are 2 ways to end the letter, as you've mentioned, yours sincerely and yours faithfully. Yours faithfully is slightly more formal than yours sincerely, and we use yours faithfully when we start the letter with something like dear doctor, dear admissions officer, dear nurse in charge. So essentially when we are using the reader's job title because we don't know their name. So in some writing tasks, you are asked to write a letter to the patient's doctor, to the admissions officer in the hospital, and so forth. When you start a letter with a job title, then you can finish the letter yours faithfully. For other letters where you have the reader's name, so dear Dr. Green, dear Mrs. Hammond, then you finish those letters yours sincerely. Anna says, do we have to include the name of the hospital in the introduction or use in our facility instead? Anna, I would suggest you don't have to use either. It is possible to write the letter without mentioning those things. You can say the patient has been hospitalized for 5 days, for example, and you don't need to mention either the name of the hospital or to use the phrase in our facility. However, if you choose to, using either the name of the hospital or in our facility is fine. Ligimol says, how do we write the introduction according to the updated criteria? So although there is now a criteria called purpose, one of the updates was